That burning in your chest, the pressure after meals, the lump in your throat that never quite goes away. What if it isn't just heartburn? What if your stomach is actually sliding into your chest right now and you don't even know it? A hiatal hernia can silently mimic heart disease, anxiety, indigestion, and even breathing problems. Millions of people live with it for years, treating the symptoms but missing the real cause. In this video, we're breaking down 10 hiatal hernia warning signs your body uses to get your attention. Some are obvious, others are shockingly easy to ignore, and one of them means you should seek medical care immediately. Let's start. Number 1. Heartburn. Heartburn is the most common and recognizable symptom associated with a hiatal hernia. It creates a burning sensation behind the breastbone, in an area called the retrosternal region. This discomfort often travels upward toward the throat and can feel like heat spreading through the chest. The burning occurs when stomach acid escapes past a weakened lower esophageal sphincter and irritates the lining of the esophagus. Unlike the stomach, the esophagus lacks a protective coating, making it highly sensitive to acid exposure. This irritation produces the classic burning pain people describe as heartburn. Timing is important with hiatal hernia-related heartburn. Symptoms often worsen between 30 minutes and 2 hours after eating, especially after large meals or trigger foods. Spicy foods, citrus fruits, tomatoes, chocolate, caffeine, and high-fat meals commonly make symptoms worse. Bending over or lying flat removes the help of gravity, allowing acid to rise more easily. Many people notice heartburn is worse at night when trying to sleep. The horizontal position allows stomach acid to flow upward through the displaced portion of the stomach. Severity ranges from mild discomfort to intense pain that may be mistaken for a heart attack. Unlike cardiac pain, hiatal hernia heartburn often improves with antacids and usually does not radiate to the jaw or arms. Still, any unexplained chest pain should always be evaluated by a medical professional. Number 2. Acid reflux. Acid reflux occurs when stomach contents repeatedly flow backward into the esophagus through a weakened lower esophageal sphincter. In people with a hiatal hernia, the altered position of the stomach disrupts normal pressure balance, making this valve far less effective. The result is frequent backflow of acidic contents that irritate the esophagus. Many people describe a sour, bitter, or metallic taste in the mouth. This taste comes from stomach acid and partially digested food reaching the back of the throat. Reflux episodes may happen during meals, shortly after eating, or even during sleep. Some people wake up with an unpleasant taste in their mouth, indicating reflux occurred overnight. Nighttime reflux is particularly harmful because acid remains in contact with the esophagus for longer periods. Activities that increase abdominal pressure, such as bending forward, lifting heavy objects, or straining, often trigger reflux. Even simple actions like tying shoes can cause acid to surge upward. Some people experience reflux occasionally, while others deal with it daily. Chronic acid reflux can lead to inflammation, ulcers, and serious complications, including precancerous changes in the esophagus. Number 3. Regurgitation. Regurgitation is different from vomiting. It involves the effortless return of swallowed food or liquid into the mouth without nausea or forceful retching. In hiatal hernia patients, the displaced stomach anatomy allows contents to move backward too easily. The regurgitated material usually tastes acidic and may contain recognizable food particles that were recently eaten. Regurgitation can occur suddenly while talking, laughing, or performing normal daily activities, making it uncomfortable and embarrassing. Some people learn to anticipate episodes based on body position, certain foods, or physical exertion. The amount can range from small mouthfuls to larger volumes that must be spit out. Repeated exposure to stomach acid can damage tooth enamel, irritate the throat, and contribute to chronic hoarseness over time. Number 4. Difficulty swallowing, also called dysphagia. Dysphagia occurs when the shifted position of the stomach interferes with the normal movement of food through the esophagus. This creates pressure or partial blockage, making swallowing feel uncomfortable or incomplete. Symptoms often develop gradually and may initially affect only certain foods. Many people describe the sensation of food sticking in the chest or throat. This stuck feeling can last seconds or minutes and may require drinking liquids to help food pass. Early dysphagia often affects solid or dry foods like meat, bread, or pills. As the condition progresses, softer foods and even liquids may become difficult to swallow. This progression can signal worsening anatomical disruption or inflammation. Dysphagia may come and go unpredictably. Someone may eat normally for days or weeks, then suddenly struggle. Stress, eating too quickly, or specific foods can trigger episodes. Over time, anxiety around eating can develop, leading to reduced intake, weight loss, nutritional deficiencies, and avoidance of social meals. Number 5, chest or upper abdominal pain. Chest pain caused by a hiatal hernia can closely resemble heart-related pain, making it especially alarming. The pain usually occurs behind the breastbone and may radiate to the back, shoulders, or arms, because the heart and esophagus share nerve pathways. This overlap makes it difficult to tell the difference without medical evaluation. The pain may feel burning, sharp, stabbing, or like a heavy pressure. Intensity varies widely, from mild discomfort to severe pain that interferes with daily life. Upper abdominal pain, also known as epigastric pain, often occurs just below the rib cage. This discomfort results from the stomach being compressed or irritated within the chest cavity. Symptoms typically worsen after meals, especially large meals, and during activities that increase abdominal pressure. Sitting upright or using antacids often brings relief. Number 6, feeling full very quickly, also known as early satiety. Early satiety means feeling uncomfortably full after eating only a small amount of food. In hiatal hernia patients, the displaced stomach cannot expand normally, sending fullness signals to the brain too soon. This sensation is different from normal satisfaction after a meal. People often feel stuffed after just a few bites. The herniated portion of the stomach is compressed by the diaphragm, reducing effective stomach capacity and interfering with normal relaxation as food enters. Digestion may slow, causing food to remain in the stomach longer than usual. Over time, early satiety can lead to unintended weight loss and nutritional deficiencies. Some people adapt by eating smaller, more frequent meals, while others struggle to meet daily nutritional needs. Symptoms may fluctuate, with liquids often being easier to tolerate than solid foods. Number 7, bloating and belching. Bloating develops when gas becomes trapped due to altered stomach anatomy. The abdomen may feel tight, stretched, or swollen, sometimes appearing visibly distended. Clothing may feel tighter around the waist. Belching occurs as the body attempts to release trapped gas, but in hiatal hernia patients, belching may provide little relief. Gas buildup can come from swallowed air or slower digestion that allows more fermentation. Carbonated drinks and gas-producing foods often worsen symptoms. Many people learn to identify and avoid personal trigger foods to reduce discomfort. Number 8, hoarseness or a sore throat. Chronic hoarseness and throat irritation can occur when stomach acid reaches the vocal cords through reflux. These tissues are delicate and easily inflamed. This condition is often called silent reflux because heartburn may be absent. Hoarseness is often worse in the morning after lying flat overnight. Additional symptoms include a persistent sore throat, frequent throat clearing, a sensation of something stuck in the throat, and chronic coughing. Symptoms may worsen after meals or acidic foods. Long-term acid exposure can lead to vocal cord injury, recurrent respiratory infections, sinus problems, and in severe cases, increased cancer risk if left untreated. Number 9, shortness of breath. Shortness of breath can occur when a large hiatal hernia occupies space in the chest cavity and compresses the lungs. This limits lung expansion and makes breathing feel shallow or labored, especially during physical activity or when lying flat. People may feel unable to take a deep breath, which can trigger anxiety and worsen symptoms. Breathing difficulty often increases when lying down because gravity allows more of the stomach to shift into the chest. Elevating the upper body during rest or sleep often provides relief. Acid reflux can also irritate the airways, triggering coughing, wheezing, or asthma-like symptoms. Breathing problems frequently worsen after large meals. Number 10, vomiting blood or passing black stools, known as melena. These symptoms signal a medical emergency. Vomiting blood or passing black, tar-like stools indicates bleeding in the upper digestive tract, usually caused by severe acid damage, ulcers, or erosion of the esophagus or stomach lining. Blood may appear bright red or resemble coffee grounds. Black stools occur when blood is digested as it moves through the intestines. These complications can lead to anemia, weakness, dizziness, or fainting if not treated promptly. Any sign of digestive bleeding requires immediate medical attention. If this video helped you recognize symptoms you may have been ignoring, like the video, share it with someone who needs it, and subscribe for more practical, science-based health insights.